This time, let's explore the female reproductive system from a vertical cross-sectional view. This view gives us a better understanding of how the reproductive organs are positioned from front to back. At the center is the uterus, where pregnancy can develop after implantation. The inner lining is the endometrium, while the strong muscular wall surrounding it is the myometrium. At the lower part of the uterus is the cervix. It forms the connection between the uterus and the vagina. Below the cervix is the vagina, a muscular canal leading to the outside of the body. In front of the vagina and uterus is the urinary bladder, which stores urine. Behind them is the rectum, which is part of the large intestine. This arrangement shows how closely the reproductive, urinary, and digestive systems are positioned within the pelvis. Each structure has its own important function, and together they form a complex and highly organized part of the human body. Knowing your anatomy helps you better understand your health and your body. Fibroids can cause different symptoms from one person to another. Common symptoms include heavy or prolonged menstrual bleeding, pelvic pressure or pain, frequent urination, lower back pain, and pain during intercourse. Some people may also experience difficulty becoming pregnant. It is important to remember that not everyone with fibroids will have symptoms. If your menstrual bleeding is unusually heavy, your pain is severe, or your symptoms are affecting your daily activities, it is important to speak with a healthcare professional. On the right side, we can compare a normal uterus with a uterus containing fibroids. The normal uterus has a typical smooth shape. In the uterus with fibroids, you can see several rounded growths within and around the uterine wall. These growths can vary in size, number, and location, which explains why symptoms can be very different from one person to another. So, what are the treatment options? Treatment depends on several factors, including the size and location of the fibroids, the symptoms they cause, a person's overall health, and their future pregnancy plans. Some people may only need regular monitoring. Medication can sometimes help manage symptoms such as heavy bleeding or pain. For some patients, minimally invasive procedures may be considered. Surgery, including procedures such as myomectomy or hysterectomy, may also be an option in certain situations. A healthcare professional can help determine which approach is most appropriate. Uterine fibroids are common, and effective management options are available. The most important thing is not to ignore unusual or persistent symptoms. Pay attention to changes in your menstrual bleeding, pelvic pain, pressure, or other symptoms that affect your quality of life. Know the signs. Get the facts. Talk to a healthcare professional. Your health matters, and you do not have to face your symptoms alone.